Hello and welcome to your Know Your Body to Love Your Body talk. It's a talk about periods and sustainable menstruation with an international guest speaker, Dr. Anu Hirachan MD. Today's talk is partnered by Go With The Flow Manila and Simula PH. So here's just a few things. We've done a Telegram official group chat and we've done a poll about who are currently menstrual cup users, and these are the results. 14% have a cup but haven't tried it yet. Surprisingly, 27% have already converted to a more sustainable option, and 60% or almost 60% have said no. So that's very interesting to note. That being said, here are some of the frequently asked questions about how well do we know our periods? Why are we always bloated? And even to some extent, like how do we correctly insert the menstrual cup? Or what even PMS is for. So these are some of the questions that our guest speaker will be addressing later on. So let me introduce to you Dr. Anu Hirachan MD. She is Chief Resident OB at the Fatima Medical University and she has done her studies in Nepal. So please welcome Dr. Anu Hirachan.
With the eggs in the fallopian tube where they will fertilize. Okay, so next slide please. So cervix, of course, we it's a very important part of our body because of the and then another, it's a vagina. So guys, so through during the sexual intercourse, through this vagina, the sperm will enter into the cervix, okay? And then when the sperm will enter into the cervix, it will pass through the uterus, and then it will go into the fallopian tube, especially the sperm. And then the ovary, every month the ovary will release the egg, and that egg will be captured by this fallopian tube where the eggs and the sperm gonna meet. Okay, if the eggs and the sperms are do not meet, if we do not have any sexual activity, then what happens to that egg? It will burst. Then we will have menstruation. Okay, so talking about menstruation, next slide. So, next slide, please. Menstruation is a woman's monthly bleeding, and then in a common layman term, we call it as a period. When you menstruate, your body discards the monthly buildup of the lining of the uterus. Menstrual blood and tissue flow from the uterus through the small opening in your cervix and pass out of your body through the vagina. And then, so in the picture, I have already told you, like, if there is no fertilization, if we do not have any sexual activity, there is no fertilization between the eggs and the sperm, what happens with the egg? The egg will now, it will burst, and then it will go back into this uterus of the tiny uterus of us, and then it will start to shed the blood, and it will come from the cervix. From the cervix it will come via vagina and then to the outside world. Okay, so next slide, please. So talking about menstrual cycle, next slide. So menstrual cycle is the monthly hormonal cycle a female body goes through to prepare for the pregnancy. So your menstrual cycle is always mostly for about 28 days, but in an average period, it is in between 28 to 35 days. Okay, so don't worry that I've got my menstrual period at around just after 35 days. Don't worry, guys. This is okay. This is an average period. It's an average window period, okay, to get a menstrual cycle. And then sometimes you will be worried, like, I have got my menstrual cycle like at around 25 days. Tiba, I just got menstrual cycle, my menses at around last week of January, now I'm just getting my menstrual cycle very fast. Don't worry. The period is between 21, or you can just say 35, 21 to 35 days. It's absolutely normal. Okay. So the time for the menstruation is approximately 4 to 7 days. Okay. So don't worry, guys, that you have menstruation for just 2 days or 3 days. And then sometimes the people may ask you, like, people might say that, people really ask me that, Doctor, I have my menstruation. It is lasting for 6 days, 7 days. Don't worry about that. It's absolutely normal to have menstruation up to 7 days. Okay. Anything beyond 7 days, it's abnormal. And then, well, we know about ovulation. It is ovulation is when the ovary releases an egg. So it can be fertilized by the sperm in order to make the baby. So our exact ovulation period is from the first day of your regla to up to 14 days. So mark that 14-day period is the ovulation. Okay, that time is the very crucial time. That time our ovaries will release the eggs. And then at that time, if you have sexual activity, there is a high chances that you're gonna have a pregnancy, you're gonna be pregnant. Okay, so next slide, please. So many of us will be scared about, we have so many, like we have different types of color blood during the period. So especially like bright red. Okay, the bright red color is most likely present at the beginning of the cycle, means it is a recent bleeding. So don't worry at all. Next slide. And then there is another, next slide, please. So dark red color, next slide. It is, this color happens with the course of the cycle. Like in the first day, you will observe bright red color. And then in the second, third day or subsequent days, you will experience dark red color. So don't worry about it. This is just your, it is just the flow of your blood. Okay. And then you don't have to worry that, doc, I have bright red color in the beginning, then in the later of my menstruation it became dark, very dark, and then again later it became very pinkish. Don't worry about it. Okay, next slide. And then see, this pinkish or very light red color, it's usually seen at the end of your menstrual cycle. Okay, so you don't have to worry about these things, but you have to worry when there is heavy amount of bleeding, and then still in the seventh day of your cycle you are still experiencing bright red color of the blood. Then at that time, that is the crucial time that you have to visit your gynecologist. Okay, and then next slide. So what's the normal amount of bleeding during the period? So we always tell like, doc, I have at least like in my first day of my regla, I usually have 6 to 7 pads per day, and then it is fully soaked. Okay, and then but remember, the average women, us, like women like us who are in the reproductive age group, the women will lose only 30 to 80 ml of blood during her entire period. Okay, so anything which goes beyond 80 ml is heavy menstrual bleeding. You need to observe it. You need, if it is going on for couple of months, you have to visit your gynecologist. Okay, and then of course periods may be lighter or heavier than the average amount. Your periods may change as you get older. In your reproductive age group, you may have high amount of like heavy bleeding sometimes, but as you advance with the age, like 40, 60, it will keep on 40, then 45, it will decrease in the amount, because that is the time when you will be heading towards menopause. Okay, so that's it. Okay, guys, so next slide. So talking about the most important thing, I really wanted to share to you guys about premenstrual syndrome. Okay, so premenstrual syndrome in like many women feel physical or mood changes during the days before menstruation. 1 or 2 days before menstruation, they feel like they have irritation, mood swings, like they want to eat a lot, and then either they want to sleep, they want to have sleep a lot, or they will suffer from insomnia. And then also during that time there will be change in sexual desire, like they don't want to have any sexual activity. Okay, and then they don't want to, and then there is a loss of their focus in the studies, concentration at their work. And then also there are some signs which are visibly seen in our body, like example acne. Some people, some girls, they will have acne 1 to 2 days prior to their menses or during the time of the menses. Okay, and then some of them also complain of breast tenderness, like, doc, I have during my menses, doc, I have breast, it's very painful, my right breast is more painful than my left. So, and then also some of you complain about headache. Some of you also complain about, like, doc, I don't do much of work, but still I feel like I'm so tired most of the time. And then, guys, these are all because of the hormonal imbalance during our menstruation. Okay, there will be increase in the estrogen, progesterone level. These are the hormones that plays an important role in during our menstruation. Okay, so next slide. So in order to treat all these menstrual syndromes like irritability, severe abdominal pain, dysmenorrhea, like acne, and then mood swings, we have to have certain uh, what do you call treatment. Okay, if it is very severe, then you have to visit your gynecologist. Okay, but if it is not that severe, your abdominal cramp may be treated by your ibuprofen special. And then also you can have paracetamol. Okay, you don't have to go to a higher level of doses. Okay, just paracetamol is enough, like at least can have 3 times a day, or 2 times a day you can have. Okay, and then if paracetamol does not work, you can also go to ibuprofen or mefenamic acid. Okay, next, the most important step is healthy lifestyle, and then exercise as well. So in our next slide I will tell you about those things. So next slide please. So exercise, guys. Can premenstrual syndrome be treated via exercise? Yes, of course, because for many women, regular aerobic exercises, it will lessen the premenstrual syndrome. It will reduce the fatigue and depression and the anxiety. Okay, exercise early in the morning or whenever you have time, you can do that. It will reduce your fatigue. It will reduce your anxiety state, because it will release certain hormones which makes you happy. Okay, and then also aerobic exercises, which includes brisk walking, running, cycling, swimming, increases your heart rate, lung function, and then thus it will really help you to get rid of all those certain kind of premenstrual syndromes like anxiety, depression. It will really help you guys. Okay, next thing, next slide. So exercise myth. Really, guys, before it was really told that physical activity during menstruation increases menstrual cramp. It's really it's a myth. It's a real known fact that physical activity really relieves our pain, our bloating, our decreases our anxiety level. Okay, so guys, even if you are having periods, first day of your periods, don't stop go I mean, like, don't hesitate to go to your gym. Don't hesitate to exercise. Okay, it's fitness is really really necessary. Okay, so next slide please. Apart from your exercise, nutritious food, you have to eat diet rich in complex carbohydrates, which reduces the mood swings and then the food cravings. These complex carbohydrates can be found in the foods made in whole grains, like whole wheat bread, pasta, and cereals. These are found. Okay, and then also you try to take lentils, beans, more of that, and then also try to take more of the green vegetables, fruits, which will help to uplift your mood. Okay, and then also guys, avoid taking caffeine, alcohol during menses. Actually, it's not we should not stop taking alcohol or caffeine, but you can reduce it. Okay, so just take it one cup of coffee early in the morning, then in the whole night, a whole day or night, stop taking all those caffeinated drinks. Okay, so next slide. And then also relaxation therapy like yoga, like doing the meditation. It will really, really, guys, in this generation, in 21st century, where we are in 2020, where we are facing such a pandemic time, relaxing our mind, relaxing our body, it will really help to decrease the anxiety, stress that is happening in our body. So we really have to like go for yoga, meditation whenever we get time, so it will really help to reduce our premenstrual syndromes. Okay, so next slide. So uh, as we have already talked about the treatment of premenstrual syndrome, let's talk about how often you should change your pads, tampons, or cups. Okay, try to change or rinse your feminine hygiene product before it becomes very soaked or fully soaked. Okay, and then change your pads every few hours. It is said that usually you guys have to we have to change our pads every 6 hours. Okay, but if it is before 6 hours, it is your pads are fully soaked, you can change, but the ideal time is every 6 to 7 hours you can change. Okay, and then tampon should be worn for more than should not be worn for more than 8 hours because of the risk of toxic shock syndrome. Okay, so usually guys, me, I prefer pads rather than tampons, and then I prefer menstrual cup rather than pads and tampon, because menstrual cups is now really in the market. Okay, so because tampon have a very very severe side effects like toxic shock syndrome, it's not that good to use tampons. Okay, so even if it is worn for more than 7 to 8 hours, it will really talaga, it will really cause you some kind of severe infection, so you have to be very careful regarding it. And then also menstrual cups and sponges, when you are using it, you have to rinse it once or twice a day very carefully. So period panties, you have to change it every day, and depending upon the style and the flow. So use a product appropriate in your size and observancy for your menstrual bleeding. Okay guys, so this is the what to do, how often you should change your pads, tampons, and cups. So now everybody is talking about menstrual cup. Okay, yeah, 51% of the women still don't have an idea about menstrual cup. They still don't know how to use menstrual cup. They still are wondering, like, is it really good to use menstrual cup, or is it like, don't it create any kind of infection when I use menstrual cup? Or is it like, should I be very cautious while using the menstrual cup? So I will give you all those answers in my upcoming slides. Okay. So next slide, please. So next slide, menstrual cup. So next slide, please. Menstrual cup. It is a type of reusable feminine hygiene product. It is small, very, very flexible. It is funnel shaped. Next slide. Funnel shaped, made of rubber and silicone that you insert into the vagina to catch the blood or the period fluid. Okay, so see, this is a small funnel shape, as you can see in the picture, like pink. You can get menstrual cup in variety of colors: pink, blue, green, yellow. So depending upon the color you want. Okay, so it is very this, it looks like it is not that flexible, but it is talaga, it is really flexible. And then this funnel shaped, this one cup will, when you insert, it will catch all your blood, and then it can hold up to 6 to 7 hours a day. Okay, and then next slide, please. So how to use your menstrual cup? So before using your menstrual cup, guys, we have to be very hygienic. Okay, wash your hand, wash your hand thoroughly. Apply a little water or a water based tube to the rim of the cup, then tightly, so next slide, then next slide slows. Tightly hold the menstrual cup in the half. Hold it in one hand with the rim facing up. Then insert the cup in the fourth picture. You can see, insert the cup rim up into the vagina like you use in the tampon without an applicator. It should sit a few inches below your cervix. Okay. Once the cup is inserted into your vagina, then you just rotate it. Okay, so that the folding part will be open, and then once the cup and then it will spring open to create an airtight seal that stops the leaks. Okay, so you should feel, you actually, when you insert your menstrual cup properly, you shouldn't feel your menstrual cup at all, because if it is inserted talaga correctly, you will not feel anything at all. You will not feel any kind of discomfort at all. You should be able to move, jump, sit, stand, and do whatever everyday household work you do. Okay, so if you're having, but guys, if you are having trouble in putting your cup, then speak to your doctor how to use it, because remember, menstrual cup comes in every sizes. Okay, it is small, medium, large, depending upon, like, are we are we like virgin, we have a small menstrual cup. Are we like sexually active, we have medium cup. And then are we like already delivered the baby, we have a large cup. Okay, depending upon the size of our vagina, we have those kinds of cups. So next slide, please. So how to remove a menstrual cup? You can wear a menstrual cup. So guys, remember, it is very this slide is very important, because you can wear a menstrual cup for about 6 to 12 hours, depending on whether or not you have a heavy flow. Remember, when you use a pad, it usually soaks within 4 to 5 hours. So you have to keep on changing it. But for the menstrual cup, it usually rests for about 6 to 12 hours. Okay. But if you really have a heavy flow, then you can change within 8 hours. You can change within 8 hours. And then this means you can use a cup for overnight protection. You don't have to use like long sanitary napkins, like it's very difficult. You have to keep on buying it. No need to wear those long maxi pads Just insert the menstrual cup, it's and then leave it for overnight, then sleep, and you will have a good night's sleep. Okay, you should remove your menstrual cup by the 12th mark. Okay, beyond 12 hours, don't go it. Okay, in terms of hygiene also. So before, beyond 12 hours, just remove it. If it like, don't put it for 13 hours, 14 hours. Okay, it's better you remove your cup in every 8 hours. But if you are going out, if for a long trip you are not able to get any kind of CR, and then you have already inserted your cup within a month for 12 hours. Okay, so if it becomes full before then, you will have to empty it ahead schedule to avoid leaks. Definitely, if it becomes full, you have, if you feel like it's becoming full, and then before it leaks, you have to remove it. Okay, next slide please. So, how to remove a menstrual cup? These are the very basic, simple steps. So, of course, hygiene is necessary. Before, always wash your hands thoroughly. Place your index finger and thumb into your vagina. Pull the stem of the cup gently until you reach the base. Then, pinch the base to release the seal and pull down to remove the cup. Once it is out, empty the cup into the sink or toilet. So next slide. Next slide, please. So uh, after we remove the cup, do you think we will just remove it like that? We'll just keep it in the sink, um, or do you think that we should care it? Because this is reusable cup. Okay, we should have a proper care of our menstrual cup. Reusable menstrual cup should be washed and wiped clean before being reinserted into the vagina. Sometimes they say that we can just clean in very boiling water, hot boiling water, for about 1 minute. Just soak it, and then we can remove it. So this is how we can clean it. Okay, so it depends from person to person. Some people just want to use a hot boiling water, some people just want to use a soap, and then some people just want to dry it after using the soap, just want to dry it in a sunlight. So it depends from person to person. But really, it is really necessary to clean it. Okay, after you use it, it's very necessary to clean it, rinse it, and then place it in a proper place. And then your cups should be emptied at least twice a day. So 8 hours, 10 hours. So the maximum time is 12 hours. So it should be emptied at least twice a day. So reusable menstrual cups are very durable. It is eco-friendly, durable, and then remember, this will last for 6 months to 10 years with a proper care. Okay? So one of my patients, she said that she had used the menstrual cup for the last 5 years, and then in those period of time she just have about five menstrual cups only, because she keep on using it. Okay, so that means it is very affordable, because when you see in a long run, it is affordable. Okay, not like menstrual, not like sanitary napkins or tampons. They are like, how many pesos? Like 80 pesos. For like 5 napkins, it is 80 pesos. Tampon is, I think, it's much more expensive. So thinking about that, the pros and cons, of course, I think the advantage of menstrual cup is very high compared to the tampons and the sanitary napkins. Well, still the people still feel uncomfortable to wear it. Still they feel like, what if it leaks in a public places? They will feel, that's why we really need to raise an awareness about menstrual cup. We really need to know how to use it, what type of the size of the menstrual cup we need it. So next slide. And then menstrual cup advantage is it is very affordable. So I've already told you it's very affordable. It is safer than tampons. Like unlike tampons, it will have, if you use for about 8 hours, it will create infection. Okay, like toxic shock syndrome. But it does not happen in menstrual cup. There is no such findings. Research talaga till update that menstrual cup will create any kind of infection or a toxic shock syndrome, and then it is better for the environment. It is very eco-friendly, and then it can't be felt during sex. And then there are some brands which cannot be felt during sex and can be worn if you are using um, any kind of intrauterine devices, or that is for the then you can still use those menstrual cups. So please feel free, guys, to wear your menstrual cup. It is very easy, eco-friendly, much more affordable. Maybe it is a little bit expensive in the first hand, but it is very, very affordable when you think about your future. So for this, so next slide. With this, I want to conclude that really. Next slide, please. Not no.
Doc, I think this is the last slide.
Okay, so from this, after this, I just want to conclude about guys. We really have to care about our body. We really need to, because caring our body means caring ourselves. We are independent women. We really need to care ourselves, our body. We should set our mind free, and then we should have a very free thinking. So let's raise an awareness about menstrual cup. Really, it is really very good, everybody. So I really encourage everybody to use menstrual cup. Okay, so that concludes my next. Okay, is it okay, guys?
Yes, Doc, thank you so much.
So thank you very much for listening. And then it's my pleasure to talk about menstruation, raising awareness. And then thank you, Castillo, so that she just mentioned me, Doc, can you talk about it? And I was like more happy to, yeah, of course, to raise awareness about menstruation, because me, I'm being a OB gynecologist. I myself want you guys to know about menstrual hygiene, how what are the products that we're going to use for during our menses, what is premenstrual syndrome, or should we be worried, very much worried about premenstrual syndrome. So these are the things that we really have to take note. Okay, you really don't have to worry about premenstrual syndrome. Yes, there are certain people like 2 to 3% of the people who will have severe premenstrual syndrome, who really needs to seek a gynecologist. Like they might have a severe anxiety problem, they may be aggravated during their period. So that time you really need to have consult to your gynae or whoever responsible it is. Okay, but during your very mild to moderate kind of a premenstrual syndrome, you can just use your therapies that I have told you. If you have severe pain, you can use just a paracetamol, ibuprofen, okay? And then if you have like go on a yoga, meditation, exercise, that is very, very necessary. Eat nutritious food. If you have acne problem, you can just go to a dermatologist. Okay, so guys, don't feel ashamed to talk about premenstrual syndrome to anybody, to your colleagues. Okay, they might help you also, to your gynecologist, so don't feel ashamed. And then um, On this note, I just want to conclude it. So thank you guys, thank you fitness, so for inviting me in your talk show. So it's a great pleasure. Thank you.
Thanks, Doc. Let's just take a quick photo together. If you can open your cameras, ladies, also. So before Doc Anu leaves, let's just show our appreciation that we do have someone from the professional field
I
here.
hope that guys, did you learn anything today?
Yes, Doc, super. It was
Is
very.
it, was it very good? Okay, now much more information.
How are you girls?
How are you
Yes,
girls
Doc. Thank you
doing?
po.
Is it okay?
Yes.
Gabrielle, is it okay?
Yes,
Was it
Doc.
informative? Thank you
It's
very much for inviting me, okay, Gabrielle. It was very, I felt very encouraged to talk about menstruation in front of you guys. So maybe later in our life, later we can talk about it again, okay?
Thank you so much, Doc. It's
Okay.
different from our lectures, from our usual lectures. So it was
Yeah,
very
that's
interesting. Thank you
why I
so
just
much.
don't wanted to talk about like how many phases you have during menstruation, because uh, we are talking to a common people. We are not talking to a medical people. Okay, so I just wanted to have a very brief, simple topic to talk about. Okay, so I hope you got it. Some kind of information, guys.
Yes, super. All right, let's take a photo, everyone. Ready? In three, two, one. All right, smile. Okay, we're gonna do another page because there's two pages. All right, here we go. In three, two, one, smile. Okay, okay, dokes. All right. Thanks so much, Doc Anu.
Thank you so much.
Thank you,
So see
Doc.
you later. Bye bye.
Okay, stop share. All right. Okay, so our next speaker will be Julia and Adi Reyes from Go With The Flow Manila. Hopefully you can see the screen. I'll just share an intro about them. So we have two partners also for today's talk. The first one will be Go With The Flow. Is Julia Reyes here in the chat, in the Zoom room? You can go ahead and unmute yourself or maybe even show your video. I think they're in the zoo today to celebrate Valentine's Day. So thank you so much also for having the time. Okay, Julia's here. Ask to unmute.
Yes, hi.
Hi.
Hello.
Hey, Julia, take it away. Tell us about your brand.
Signal dito, so I apologize for any delays. But hi, I'm Julia. I'm currently part of your body from.
Is it a little laggy? Oh, where did she go? Is she still here? Nawala ba siya? Hello, Julia. Are you here?
Hi.
Hi, you're back. I can see you na. I'll spotlight you.
Yay. Okay.
We can hear you though, but ako I can't.
I am sorry if there's any lag. Hi, I'm Julia.
Hi, Julia.
I I'm currently part of the program. Thank you so much for all the support that's having us today. So I am the co-founder of Go with the Flow with my sister Addie. Sorry, we're currently in the Zoom for our niece para makapag-date yung parents niya. Um, but basically, Go with the Flow, we started it as our passion project because both of us have really bad period cramps and PMS. Um, so we wanted something that could be like a period bestie, like a hub that helps you through that time of the month. So we have a few products that we developed. One of them, our best seller, is definitely our reusable cloth pads. So what are your reusable cloth pads? Does anybody know how long it takes for um, disposable napkins to biodegrade into the environment? Anyone? Anyone? No? Um, so it actually takes about 500 to 800 years for our napkins to, biodegrade. So for us, grabe, wow, that is a long time. And one pad actually consists of about 5 plastic bags. So as women who get our periods every month, parang sobrang natamaan din kami na we're one of the biggest pollutants as the Philippines is a very like napkin based community. So for us, we wanted to spread the love on reusable cloth pads. What what is it made of, ba? So basically, it's made of three types of cloth. The first one is cotton woven fabric. That's the outside, so you make pretty designs. And then inside, there's cotton terry, which is a more absorbent fabric. And then third is there's a waterproof layer. So what does that mean? Basically, like it helps it helps the pad become so much more absorbent. And then it also helps it be leak proof. Like yung usual question sa amin is, oh my gosh, hindi ba yun tatagos? Like, mas madaling matagosan. And kami din, we were super skeptic nung start. But it's actually parang for us better pa than pads because it's waterproof underneath. So then it never really leaks there. It will just leak if, like a normal pad na sobrang dami ng laman and it overflows outside of the pad. And then for us din kasi, we have sensitive skin down there. So with the sanitary pads, I used to get a lot of irritation. And with the cloth pads, parang wala kang suot, parang kasi siyang fancy. Okay, it's not as invisible there as a cup, but it's just parang panty there. So it's so much more breathable and it's so much more oh no, hello.
Hi, you're still here. We can see you.
Hello.
Hi, Julia.
Okay. Which part was it cut off? Sorry.
Not
Saan tayo
visible
naputol?
as the cup.
Oh yeah, so it's not as invisible as the cup down there, but it's parang nakapanty ka lang. So it's so much better for the skin. And yeah, so for us super converts kami. And you can also use it with cups because sometimes I know some of my friends who use cups. Ako kasi sorry, hindi pa ako ready. I tried it before and it takes some patience, I guess, to uh, get the hang of the cup. So right now my baby step is the period pad. So but my friends with cups use them as well for either when they go to sleep they wear the pads or they use our panty liners as well kapag naka-cup. So yun, and then aside from from the pads, we wanted to make it kind of a hub that's earth friendly. So we also have period teas. So we have a PMS tea and a cramps tea, and we also have essential oil blends that have helped me so much with my cramps. So we have a cramps one and a PMS one, and then we have a rechargeable hot compress. Oh my gosh, that charges super fast and stays hot for quite a while kasi, uh, when you need some warmth there. So yeah, let's go with the flow. And thank you so much, FlexFit, for having us. We have a giveaway coming up. Um, I don't know when exactly, but we have a giveaway. And then also for our FlexFit sisters, we are offering this week a 10% off. So if you fill out the form, there's a part that says, how did you hear about Go with the Flow? If you write FlexFit there, we'll give you an extra 10% off with your whole purchase. So yeah, thank you. And if you have any questions, just let me know.
Thank you so much, Julia. I love how bubbly your personality is. You're very flex sister.
Yes.
Thank you so much. Go with the flow, MNL. Say hi to your sister for us.
Yeah,
Um,
she's busy with her niece kasi.
all right. Thanks so much, Julia.
Thank you. Thank you for the talk.
Okay, stop share. Enjoy the zoo. Yes. All right. So our next speaker
Yes, we will.
will be from
Thank
Simula.
you.
So I think Celine is already in here as well. Let me just.
Yeah, I think my partner Maan will be speaking on behalf of us.
Okay, no problem.
Also here. Hi guys.
Hi.
Right.
Hi, this is Maan from Simula. I can't share my video kasi low yung signal here. So,
Problem.
yun, yeah. Anyway, so we started Simula. Sel and I started Simula because we had a hard time looking for sustainable products here in the country. So, we actually started it based on our personal experience to make sustainable products more accessible to every Filipino here in the country. So, hindi lang siya for menstrual cups and pads. We have that also. But we have a lot of products and partners for our sustainable products. So, we actually partnered with Go with the Flow also. So, they're available in our website. So, if you visit our website, now we have our 10% off site-wide. So, yeah, hanggang Feb 17 siya. And then, uh, yeah, basically, yeah, we're Simula and we have a lot of sustainable products from home to beauty to um, uh, 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 bottles to razors and to reusable straws. So, there. Yeah, actually, I'm a personal user of the menstrual cup. It depends on how ready you are to shift to a cup. So Cell naman is into the menstrual pads. So we actually encourage our customers when they message us about different products of ours that we personally use it. Um, so that's how actually that's our approach now. It's more of a personal journey for both us, Nicel, and then for our customers also. That's how we encourage people to join the sustainable journey there.
All right. Thanks so much, Maan and Sel, for being here, being present in our little talk about periods and our cycles. And we also want to encourage shopping locally, and small businesses in the Philippines are already booming. And we also want to acknowledge women businesses because it's really hard to manage a business, let alone being a woman, right? So yeah, thank you so much, and you're welcome. Um, you've heard naman, girls, ladies. There's like a lot of discount codes for us. Make sure to visit their website as well. It's simula.ph. Thank you. Thanks, Man and Sel. Awesome.
Thank you guys.
All right. So I think before we end, let's just go back to our FlexFit slides here. I just want to share that you're a woman and that's your superpower. So we got this, ladies. It's Valentine's Day, and I'm sure you all have different plans. And before we end, let's just take one final picture together. Um, if you can open up your cameras, let's just take a not the class picture, but a get together. Hopefully everyone's here. Everyone's beautiful, glowing. Um, so yeah, is Lexi still here? Yes, Lexi's still here. Our CEO, do you have any last words before we end, babe?
Let's have fun today. Congratulations to all the winners. And thank you so much for all of the partners that we have today, especially Simula, Go with the Flow, and our beautiful lady doctors today.
All right. Ladies, let's take a picture in 1, 2, 3, smile. All right. Thanks, guys. Thank you so much for coming today. Appreciate y'all. Thanks so much for your time. Have a great day, Valentine's Day. Maybe a lunch date or a dinner date with your family, your boyfriend, friends. I'm gonna meet with Monina now. I'm gonna
Happy
Happy
Valentine's Day.
Valentine's.
Bye.
Bye, ladies. Thank you. Thank you so much for supporting small businesses also. Thanks, Alexa, for bringing in Dr. Anu. You are the best.
No problem. Happy Valentine's Day. Bye.
Happy day. Bye, guys. Thank you.